So welcome everyone and good day from my part. I hope you can hear me and see me online also. Welcome to this session. You see my title here, and I'm feeling very thankful to be able to present my research here today. My name is, as you see there, Maria Björkmark. I am a PhD from Åbo Academy University in Vasa, Finland. So my background is that I'm a registered nurse, a public health nurse. And so I've been studying in the field of nursing science. And I just defended my dissertation a year ago. And I will talk to you a little bit about my research first, and then about training and education. This is my co-author, Professor Linda Nyholm, who right now is working as a professor at the University of Stavanger, Norway. So firstly, I will talk a little bit about my dissertation, which I finished in March 2023, a little bit more than a year ago. This can be found online, so you can find the whole thing. From broken to whole human being, suffering, health, and caring after religious disaffiliation. So first of all, I want to say that being here today with experts on cult studies, many of the things that I will say are obvious and you already know that. So I'll just shortly present the results of my dissertation. Then I will talk about what we are doing in Finland right now, as I am come from Finland, and we are just in the beginning stages of working with this topic in Finland. So this was the aim of my thesis. And we use the term religious disaffiliation. And we also I have used the concept high cost religious group throughout my research. My dissertation was the first of its kind within nursing science, I believe also in the Nordic countries. This has not been studied very much, and not within other fields of studies either in Finland. So this is quite novel in our countries. My dissertation is made up of 3 sub-studies. These are all qualitative studies. And at first I interviewed 18 participants who had left different religious communities in Finland. And shortly I will show you from what groups they left. The third study I have in my dissertation is a study with healthcare professionals, nurses and psychologists working with people in this life situation. And you're welcome to ask questions and comment, and you can take them also at the end. So the groups that these people, these participants have left were, as we heard about already today, Jehovah's Witnesses. I don't know if you're familiar with the term Lestadianism. I didn't think so either. We know about it in the Nordic countries, but it's a big, in Norway, you know about that too. A big revival movement with this is under the Lutheran Church in Finland and also in other countries. This movement started in Lapland in the 1800s, and it's a big, huge group, very conservative group in Finland, where, for instance, it's common still today that they have very large families, and it's very conservative. So 5 of my participants came from that movement, and then we have other congregations, as you can see there. And the term high-cost religious group, as you know probably already, you use that instead of using the word cult or sect, but that means that the group is such that demands a lot from their participants, demands a lot of time and commitment, and also there are high costs when a person leaves that group. My research stems from my own experience of leading a high-cost religious group. Okay, and the third study that I conducted was one, as I said, on nurses and psychologists that had worked with people that had left such a group. And I had 9 participants here. And these were all, as I said, qualitative studies this one was analyzed with the qualitative content analysis. Before I go to the results, I want to show you a quote that I have used throughout my presentations of my research, which I like a lot. When you have been marinated in this since childhood, how can I get rid of the marinade? Says one of the women who left a religious, high-class religious group. And I said, I think this is very, gives a good picture of that. The marinade, as I well know myself, goes into your pores and it goes into your backbone. And you've been, for instance, if you have been born into such a group, it's hard to get rid of this, even if you would like to get rid of this. It has affected all of you. So I will shortly talk about the results of my studies. As I said, many of you are familiar with these results. The participants talked about living between two different worlds, at least at first. They talked about living with fear and guilt. They talked about sorrow and pain over what one has lost, and broken as a human being. This is a quote that one of my participants used. And with that, they were talking about how this affected their mental health because they were so broken. Of course, this led to different mental health issues. I will come back to those issues soon. Then they also talked about suffering of life. We have heard today about being rejected, about being shunned, and the pain and sorrow that comes from that, of course. Overwhelmed by guilt and shame, this is very common, as you know. And they talked about living in constant fear of both life and death. There were many things that they were afraid of going to hell and Armageddon and all these things, but also afraid in this life, afraid of meeting someone from that religious group or the condemnation of others. And humiliation, we all know what that is about when a person is humiliated down to the core. And they talked about a lifelong process, as you know. They talked about identity confusion, identity crisis. That's something that all of the people here attending this conference are familiar with. Finding your true self, finding new ways at looking at the world, and building a new life. So here's where we healthcare professionals can come in and help a person with these things and help them build a new life. And when I talk about healthcare professionals in my studies, I'm not only talking about nurses. I think that this knowledge applies to whoever meets a person in this situation. Psychologists, doctors, therapists, social workers, this can be applied. So this is what we are working on in Finland to grow this knowledge and that the awareness would be increased. The participants in my study talked about their effects on mental health. And I'm sure that you're familiar also with that people have these kind of problems. Of course, if you're shunned and you're feeling a lot of fear and guilt and shame, of course it will affect your mental health. So how can we help a person that is suffering from this? And I don't think it comes as a surprise to anyone, but the results of my studies show that the clients in this life situation did not receive the support and understanding that they would have needed, at least not in Finland. But I've understood that this is common in the Nordic countries, that there is no understanding or knowledge, and also more globally. So that is why this research is so important. And I'm also very happy that in Finland, I received a lot of media attention after I defended my dissertation, and I was in all kinds of newspapers and radio interviews. So I was happy about that, that the awareness is increasing there. And other research has also shown that people don't get the help that they need. The results of my studies also show this, as you well know, that it's not only suffering and misery, it's also a life of freedom and joy that people experience. That wow, like we heard about in the previous session, like waking up and realizing, wow, I have a wonderful life and I can have all these. But at the beginning, it can be very, very difficult before you find these and you feel that you have been empowered, for instance. Many are nodding, so you know what I'm talking. But what the important thing about this research is that what I ask the participants, that what is caring and supportive of health? What is, as I represent a form of nursing science that is called caring science, what is it that is caring for people, and how can we help them so that they move towards health instead of the suffering? And the results of my studies show this, that what we as a healthcare professional can do. And I have said many times that none of this is any revolutionary new knowledge, because healthcare professionals can already do this. They can create a relationship based on trust and safety. They have the tools, but they don't have the understanding of what religious disaffiliation means or leaving a cult. But we need to begin with that trust and safety, because many of them have trust issues, as you know. We need to confirm what they have experienced. Many of my participants talked about that the professional that they met, they didn't believe them, they didn't take them seriously, they minimized their experiences. And I have talked about that this makes for double suffering. First, you have the suffering you have encountered during your life, and then it's double up when the person you're trying to get help from doesn't understand or minimizes your experience. So confirmation is very important. Understanding, the participants all talked about understanding. The other person needs to understand what I'm talking about. And we need to support the broken human being, the person that is suffering from mental health issues. There needs to be collaboration between different professions, the doctor, psychiatrists, the social worker. We need to collaborate so that the person can get help with their issues and their mental health problems. And then lastly, to provide guidance in finding new direction in life. So we, of course, sometimes need to help people find a new job, find new friends, everything, you know, when your life has to be rebuilt. So in a way, these results look quite obvious. Of course, this is what people need. But when I listened to my participants, they had not received this. They had suffered because they didn't get help. They didn't get support. And some of them said that I didn't even try to talk to the doctor or the nurse or the psychologist, because I thought they won't understand me anyways. So what the results show is that healthcare professionals are still cautious to discuss spiritual and religious matters with their clients in Finland, in the Nordic countries. For decades within nursing all over the world, in the United States, wherever, we have talked about that the human being, the person is body, soul, and spirit. And we can, within medicine or nursing, we are good at taking care of the body. And we also are quite good at talking about mental issues, psychological issues today. But I would say that the spiritual part, the spirit is not taken care of. And as you said, people are afraid of that. They don't listen. They don't want to listen. I mean, the doctors and the nurses and the psychologists, we're not caring for those spiritual needs. But we need healthcare professionals who dare discuss these spiritual questions, also the ones that are painful. And when you said that about that they don't want to listen, so many of the healthcare professionals I interviewed said that they're afraid. So that's why they don't want to listen. They don't want to go there because they don't have training. They don't dare talk about these issues. So that's why we need to give them that courage. And I talk about that courage. I'll come to that soon. They said, give me more knowledge, give me more information. I need that. And that's great and positive. And we have hope in that they want to understand more and they want more training and education, which I come to now. This is what the participants asked or said that, for instance, you could give us training about information on how to bring up and deal with religious questions, knowledge about clients with different religious backgrounds and affiliations. We have big, like I said, we have big religious movements in Finland, and we now have more and more internationalization. So we have clients that come from a Muslim background and such, and the healthcare professionals want more information about this. And they wanted information about the biggest community we have in Finland. What are their common practices and how do they work? So and also they talked about that we need to reflect over our own position in regards to religious matters. If you're afraid or you don't, or you have lots of prejudice, you need to deal with that also and think about that before you start talking to your client. So these are not impossible at all to arrange training about. These are things that we can and already have started to work on. Of course, we need that increased awareness and knowledge. I've talked about that many times because of this fear that I talked about, to decrease that fear, that it's not that difficult. It's not that dangerous to talk about these things. The participants emphasize that they need general knowledge about religious and existential issues, and they also need specific knowledge about religious disaffiliation or cults, etc. So what we propose and what we hope for in Finland is that we could get these topics into, first of all, the basic education of healthcare professionals, nurses, doctors, social workers, anyone, the basic education, college level. Then we also propose that this would go into continuing education. So those who already have a profession within the field, that they could get continuing education and get courses on this, which is what they want. And then we believe that there should be some healthcare professionals that are specialized in spiritual care or in these religious questions, that there could be in every organization, maybe in a hospital, there could be somebody that's specialized, not just the hospital chaplain, but someone else that knows more about these and who you could maybe call and ask, please, could you come and talk to this person? This is something that we are planning, or at least at thought stage so far. So it's all about the courage, and I've said that already, to talk about these issues. Because like you said about treating the symptoms, but what if the client's core issue is that has to do with their religion or their affiliation? That's where we need to go, to that core. So now I'm going to give you some examples of what we have done in Finland and in the Nordic countries, and what is going on right now. Like I said, we're just in our baby steps, but things are moving forward. This is my colleague, Cecilia Harding, from the University of Umeå in Sweden. She just defended her dissertation in January of this year. You can find her dissertation online if you just Google her name and dissertation. And she is a psychiatrist, which has looked at former cult members. And I'm very happy because this shows that this field of research is going forward in our countries, And I cooperate together with her. I'm very happy that we found each other because we can work on these topics together. In my reference list, I have her dissertation and also 2 articles that she's published. So if you're interested, you can look at that. But her results, the results of her research show that former cult members, they have difficulties with trust. They don't trust the healthcare professionals. They've been told that they are evil and they are not of God. And they have difficulties communicating their needs, as we've heard during these days, that it's difficult to say what you really need when you haven't been taught that ever. Maybe you are familiar with this interview, but I wasn't before I talked to Cecilia. Are you familiar with this cultural formulation interview? This is one example of something that we can teach to healthcare professionals. This is part of the DSM-5, which is given out by the American Psychological Association, the Diagnose and Manual of Mental Disorders that is used all over the world. They created this interview and this interview guide, and where you can ask questions of your client relating to different cultures. And here it's based on these 4 different themes in the interview. But I think this is an excellent example of where a doctor or a nurse could use this interview guide and ask questions that pertain not just to religion, but to their culture, to their background. And in the interview guide, there are questions, for instance, like this one. Are there any aspects of your background or identity that are causing difficulties for you? Well, first they talk about the positive, of course, but what is in your cultural background or your religious background? But then start talking about, are there things that might be causing problems for you? So this is one example of something that can be used and taught. And I'm happy to say that together with Cecilia Hudding, we have created a Nordic network of researchers in the Nordic countries to look at religious affiliation leaving a cult, and that we could together do research about this topic. I'm very happy about that. 2 professors from Norway we have in the network so far, Cecilia and I, but we hope to get that to grow and to be able to do collaborative research. And just shortly, I see that I'm running out of time, but I have a colleague in Finland who has done research on children in high-cost religious groups. And she wrote her thesis on this, and from a social worker's perspective. And I think this is interesting because social workers need to be aware of the challenges with children and also child protective services that become very needed in some cases. And I think I'm running out of time, so I'll just go over this shortly, but here are some suggestions that she has in her thesis about what do social workers and child protective services professionals need. Understanding the cult, the religious community, how can that be beneficial for the child, but how can that also be very challenging? And sometimes the teachings can be a threat to their normal growth and development. But I think these things can be applied also to other care professionals, and also when it comes to adults. How do we understand this? How can we talk about sexual abuse, for instance, or religious abuse? How can we identify that? How can we confront that? Those are not easy subjects, but that is something we need to bring up. And now I'm going to show some examples from Finland. We have this that has been given out by the Ministry of Social and Healthcare. an action plan for the prevention of violence against children. And there is one chapter in this action plan about children in high-cost religious groups. So there too, the discussion has been created and is ongoing. So I think that's very, very good. I want to show an example of the Finnish Institute for Health and Welfare and the Barnahus project in Finland had a webinar, of which I also attended in 2023, about religious, the Finnish language is very difficult, so I don't expect you to understand that. But religious abuse in religious communities from a child's point of view. And they had it was two parts. And the first part that I attended, there were 800 participants. This is the biggest webinar they have ever arranged. So it showed that there's a huge need. Everybody was interested in this. Working, there were police that participated, there were social workers, doctors, nurses, therapists. So that just shows how big the need is also in our country. And what we are continuing to work on in Finland is recommendations and current care guidelines. We have a working group from different professions, psychiatrists, therapists, working on, for instance, recommendations for clients who have encountered religious abuse. So this is going on in our country. I'm sorry now I'm talking very fast because I realize that I have maybe too much to say. This we are very excited about. This mentalhub.fi in Finland is a website that is huge. There are millions of Finnish people that go into this site every year, and it talks about mental health. And there are self-help programs and internet therapies, all kinds of things that you can go in and read for yourself and do different exercises. This fall, we will launch a self-help program that is about religious abuse. So people can go in and read and get information about this. And one day we hope that this will open up a specific part of this for professionals also. I want to say something about peer support at the end, and that's why I will jump that one. In my research, as within a lot of research, the most valuable support for a person is to find peer support, like we have here today, that find others who have experienced the same that I have been going through, and I'm not alone. I want to advertise for support for victims of religions in Finland. I am a member of their board and have myself benefited from this organization. This is the largest NGO in the Nordic countries when it comes to support for people that have encountered difficulties, supported by the state, and we have 2 employees. So there's a lot of activities, a lot of things going on in Finland. And you can go in and read more about that. We don't have very much about Finland, in English, sorry, but we have some information in English. This organization arranges support groups all over Finland, both online support groups, but also ones where you can meet face to face. And there are support groups for people that have left Jehovah's Witnesses or charismatic movements, or as you see, an English one, international peer support group in English. We also have a support group for people that have left Islam. So this is a very active organization in Finland, and we put out a lot of information, and there's a lot of awareness that comes also through this organization. So I believe that this organization is making an impact on our society and helping to open up this subject and so that people would understand better. Okay, there is my dissertation. You can find that online. Also, you can read that. And my references are there. And then lastly, I just want to say thank you for your attention and now for questions or comments.